Within the Sussex Health and Care workforce, we've got the most amazing people that do incredible things every day. We've actually got a total of 35,000 people who work in the NHS in Sussex, but we still have vacancies. And that's putting immense pressure on the people that are working in each of the units that we have. So we do need to be able to grow our workforce and encourage more people to join the service. What I would really like to achieve is actually local people working in the local health system to support and deliver care to local people. But we need to give people reasons to join the health service. And if you listen to the news on a daily basis, all you hear are the bad news stories. What you never hear is all the fantastic work that people do on a day-to-day basis. You know, whether it's working with patients who are very sick, people who need support. You know, there's many different roles within the NHS and also social care. And I think actually if we can create this as a really fulfilling career, then we can encourage more people to join us. And also if that happens, we'll then be able to help to retain people more as well, because we also need to hang on to the people that we've currently got. I think in Sussex we're really lucky because we've got three fantastic universities, the University of Sussex, the University of Brighton and the University of Chichester. So I think we're very well served with graduates that potentially, if we can persuade them after they've done their training in Sussex to stay in Sussex, that for me will be a fantastic situation. We're also served by some fantastic further education colleges, that work together as part of Further Education Sussex. And again, I think if we can build partnerships with these education establishments, both for new students and also mature students, then I think actually we can create something really special here. So I think we're well served in Sussex to do something different. And I think if we really get this right, there'll be an opportunity to create career pathways where people can work in different parts of the NHS and social care system to have a really fulfilling career and to make a real difference to the population of Sussex. Well, I think a really important component of our new integrated care strategy is how we can help our workforce work together as one team. Because actually integrated care means joining up services. Now that's easy to say, but one of the things we need to do is to give people the opportunity to work in different parts of the service, and whether that's in the health system or indeed in social care as well. So if we can create opportunities for people to work in different parts of the health and care system, then that will enable people to not only improve their professional development, but increase their personal satisfaction by understanding a greater part of our system. Well, there's no doubt in my mind that the new workforce plan of our strategy has to make sure that we look after our staff. And we need to do that through a number of different lenses, because our staff in both health and social care work incredibly hard every day. So the first thing we need to do is to ensure that we can fill as many of those vacancies as quickly as possible, to ensure that people aren't having to work extra shifts an unnecessary length of time. We also need to make sure we're wrapping health and well-being support around our staff, because we need to look after them and keep them well as well. And then in addition to that, we need to think about our terms and conditions. So how can we make more flexible times for people to work when they're available or when they want to work? Because all of that will help to retain people in the service, whether it be in health or care. Because without our staff, the NHS and social care really is nothing.